Hi, I'm Dr. Kasraeian, and today I want to talk to you about your prostate cancer and how to better use the information about your particular cancers to personalize your discussions of what to do next. One thing that's really important to look at is the stage of your cancer. Basically, ask your urologist that whether your prostate biopsy was done because 1, you had an elevated PSA, 2, you had an abnormality on the prostate on the rectal exam, or 3, all of the above. Basically, that becomes an important thing for us to find out of how aggressive your prostate cancer may be and to allow us to do a thing called risk stratification, where we use this information to find out whether you have a low-risk prostate cancer, an intermediate-risk prostate cancer, or a high-risk prostate cancer. So if your biopsy was done because your PSA was elevated alone and you had a normal rectal exam, this makes this a T1C prostate cancer. If you have a nodule, it's a T2 cancer, and how big the prostate nodule is, whether it involves half of one side of the prostate, more than one half of one side of the prostate, or both sides of the prostate, become very important in finding out whether this cancer is a little bit more aggressive, intermediate aggressiveness, or it's a low-risk cancer. The other thing that's very important to look at is what's your PSA? Is your PSA less than 10? Is it between 10 and 20? Or is it more than 20? That also helps us better risk stratify your particular cancer. The last thing to kind of keep in mind is your Gleason score. Basically what a Gleason score is your pathologist takes your cells under the microscope and assigns a number from 1 to 5, with 1 being less aggressive and 5 being more aggressive, and adds that to the second most common area, which is also assigned from 1 to 5 to give you a total score which ranges from 2 to 10. 7 kind of serves as a fence that divides aggressive cancers like 8, 9s, and 10s from less aggressive cancers, which are 6, 5s, and 4. Low-risk cancers are a PSA of less than 10, a no nodule, which makes it a T1C cancer, or a small nodule on one half of one side of the prostate, a T2A cancer, or if you have a Gleason score of 6 or less. If you have a Gleason score of 7, a PSA between 10 to 20, or a T2B cancer involving one half of the prostate, that's an intermediate risk cancer. If you have nodules on both sides, a PSA greater than 20, or a Gleason score of 8 to 10, that makes it a more aggressive prostate cancer, and then the management options can be better delineated based on these options.